Today we demonstrate our technique. This is a more unique case, an anterior lateral meniscal root tear. So you can see here this patient had a radial tear right off of the root attachment. There was decent mobility. Decision was made to try to attempt an anterior lateral root repair. So here we have, through the lateral portal, we're preparing this area. And then we're going to place a passport cannula to prevent any suture bridging. Following this, the key here is to be able to get bites anteriorly, which would be more challenging with these devices. So we make a very far medial portal. I'm using knee scorpion, and we're going to do a cinch stitch here. And then we're going to prepare the root attachment for the lateral meniscus. And then we're going to shave this area. And then just because of the way that this will dunk, we're going to have to come from a different angle. So we're going to do more of a capsular stitch here, because you don't want to interfere with the healing process, and this is more of an on-lay fashion. So we're going to use our C-clamp to demonstrate where we're going to dunk this. And then we're going to place our punch, followed by a 4.75 swivel lock. You can see as we're dunking this, this is pulling the root down, and there is no suture in the way of the healing to the surface. And now we're going to sequentially tighten the swivel lock. You can see here we're able to get this almost completely back to the root attachment. Thank you.